Hello, I'm Barbara Ernico, Temple alum from the 1971 School of Social Work and currently serving on the Board of Visitors for the College of Public Health. This webinar is part of the College of Public Health's COVID-19 Beyond the Biology series. We'll focus on how COVID-19 has impacted public services that address both violence for adults and children in Philadelphia. Joining me today are Paul DiLorenzo and Kendra Van de Water, both Temple alumni from the College of Public Health and leaders in their fields. Paul DiLorenzo is Interim Executive Director of the Philadelphia Children's Alliance, which supports children who are victims of sexual violence. And Kendra Van de Water is Director of Programs at the Anti-Violence Partnership of Philadelphia. She is coordinating a better response to homicides in the city of Philadelphia. She is also the founder of YEAH, Youth Empowerment for Advancement Hangout, in which she works with teens who have witnessed or engaged in violence to elevate their lives in the aftermath of homicide. Welcome to you both.
Thank you, it's good to be here.
Thank you.
Paul, let me begin with you. You're working with child victims of sexual assault in Philadelphia, and your program has a very unique format for addressing sexual assault with children. Tell us how COVID-19 has impacted your work, and if you would help us understand both the impact on the clients, whether or not assault has changed, impact has changed, and secondly, how has the virus impacted your service delivery model? So it's so unique, and I'm wondering how it's been impacted.
Well, let me tell you a little bit about the Philadelphia Children's Alliance first, and then I can tell you and respond to your question, Barbara. The Philadelphia Children's Alliance is the city's child advocacy center. We are 30 years old. And over the years, we've served probably about 30,000 children. We serve upwards of right now an average of about 3,000 per year. We're an independent nonprofit organization that essentially promotes healing and justice for children in Philadelphia who've been sexually abused. We use a multidisciplinary team approach. We work closely and in conjunction and literally in the same building as DHS, the Philadelphia Police Department, the Philadelphia District Attorney's Office, and the two hospitals for children, St. Chris's and CHOP. The building itself is called the Philadelphia Safety Collaborative, and it's a co-located child and family-friendly facility. And we're respected and recognized for the work that we've done nationally, in part because of the duration of the time that we've been in this work. We've had strong and stable leadership for the 30-year tenure. I came back as an interim director after having been one of the five founders 30 years ago. So I was honored to come back. I had been at Casey Family Programs prior to that. The team at PCA right now is dealing with a number of issues, and I think we're probably similar to what a lot of child welfare agencies in the country are dealing with, because we're trying to make sure that we attend to all of the really serious and immediate, more urgent cases that are emerging in our reports to the agency. But on the other hand, we have to be conscious of the safety and well-being of our team members, and especially when we're all kind of in a building together. So we've had to limit the number of people who are in the building, and we are only responding to those cases that we have now established an emergency criteria for, doing that in partnership and in conjunction with what the police department and DHS have asked us to do. It's a little bit of a confusing time and difficult for everyone. Most of all of the staff are working from home. There's been an impact on our service delivery because we're based on a team model. One of the reasons that we are as strong and as unique as we are is because of the team approach. No one agency is the lead. we work together in collaboration. So not being in the same space, literally in the same space, can be a challenge for people. There have been high cancellation rates, as you can imagine. People don't want to go out. And so whether it's for interviews or medical appointments or any of the things that we do at PCA, the cancellation rates have been high. And oddly enough, maybe not so oddly enough, the child abuse reporting rates in the city have dropped, and referrals to our agency have dropped pretty significantly. And even though we're continuing to see people virtually, whether it's by phone or FaceTime or whatever it is that we can do for counseling and some of the follow-up advocacy work we do with families, there is a drop-off, no question about that. And we're concerned because of that social isolation that families face. And then I guess finally, the thing that we're dealing with is the stress and the strain that this puts on my team members who, are every day having to, deal with not only their own family situations, but also the situations of these very delicate kids and their families.
It'd be interesting to see, you said that the referrals have dropped off, to see what efforts you'll need to do to regain your service momentum in the future.
Yeah, that's a real issue. I think, it's taken years, as I said, 30 years to create within Philadelphia a momentum on how kids can be interviewed, right? The interview by a trained forensic interviewer or somebody at PCA who really understands childhood development and understands trauma and understands all of the issues that face kids and their families. And now to be out of that rhythm, even though we'll get people back into it eventually, it's going to be difficult. And again, we're concerned about the kids who are not being seen, whose cases might not be quite as pressing, but still have a desire and a need to tell their story.
Absolutely. We worry about the stress on all of these vulnerable populations. Kendra, you're in a unique position to work with both adults and teenagers who are victims of violence in Philadelphia. In your professional opinion, which populations do you see COVID-19 affecting the most?
So I think it affects both in different ways, but I believe my worry is mostly for the young people. And in my opinion, it's just a time of, schools being closed and people having to be home, and the mental health symptoms are exacerbated and people need a lot of support during this time. And I mean, even outside of the young people, adults have lost their jobs and, they're struggling. So this time has been trying to focus on providing the immediate needs for families. But as far as young people, just trying to engage as much as possible on video and social media to keep them connected, because their moods improve when, even if the programming is not as great as in person, they need support, whether it be on video or, whether it be no contact dropping groceries off at their home. So I think, in my professional opinion, I believe that the young people, it really worries me for everyone, but I'm really stressed about the younger folks.
Yeah. And tell us a little bit about your work with those young teens. So what do you do on a regular basis with them?
Right. So we are very new. I'm the co-founder of Yeah, as you mentioned. We work with teenagers who have witnessed or engaged in some type of violence. So we've only been around since about January 2019, and it's grown to this huge following of teenagers in neighborhoods. We focused in West and Southwest Philly, and we're starting to expand to other neighborhoods across the city. So on a regular day, we do a lot of group programming, psychoeducational groups. We do a lot of community engagement. We do things around stress and trauma and, engaging with the police districts. We have a teen food bank. We have case management for the teens. So this has really impacted us because everything we do is in person. And, you know, it's done also evenings and weekends when the times where violence and youth violence is usually higher. And we do a lot of peer mediation. That's probably our biggest thing. So we're not able to do those things in person, and we have moved to online programming right now. And we're doing a lot of video groups. We're doing individual check-ins on videos. And then since we're able to pay teenagers, you know, we had our pilot job program. We were able to hire 30 teenagers to do peer mediation in schools, in certain schools. So since the schools are closed, we're actually able to continue paying the teens, and we're just moving the tasks to online things, you know, like creating videos around conflict resolution, researching politicians and writing a letter to certain people about gun violence. So we have to focus this around violence and reducing violence. So we're just trying to find alternative methods to keep them engaged.
And your program with adults is really working with the police and the coroners, and tell us a little bit about that.
Yes, so at Anti-Violence Partnership, I'm the director of initiative that focuses on homicide and complex homicides. So homicides where family members have murdered other family members, or domestic violence murders. And so trying to improve the response and just make the services better as far as making them more survivor-centered. So survivors of homicide have all of these needs that, you know, we're trying to research and make sure the services are improved to meet those needs that come specifically from survivors and their perception of what has happened to them in the aftermath of a homicide. So I work a lot with systems, the district attorney's office, the homicide unit, police department, the medical examiner's office, and basically interviewing survivors who about all the systems that they've gone through, you know, what would have been helpful, what can be changed, and then we're taking their interviews and we're working to strengthen the services and provide different resources. Like we're creating brochures. I was able to purchase a resource guide from a survivor whose son was murdered. So basically elevating their experiences and making sure the services we're providing fit their needs and they're not based on what we think that survivors' needs are.
So are most of those programs shut down? I mean, how is the coroner's office dealing with, or the police department dealing with a homicide now? Do they come out?
Yeah.
Do they work together?
Right. So there's a lot of different things happening. So the medical examiner's office, right? It's completely closed to the public right now. Now, if there's a homicide that happens, they're on a case-by-case basis. You can't just walk in there. So if a family member comes, it's limited to who, and they're identifying their loved one through a picture. And so the process is very different, and it's hard, right? Because people want to see their loved ones and, you know, say goodbye, but these are things that have been impacted. So it's limited contact and limited people and completely closed to the public. Now, homicides are still being investigated, but the homicide unit is practicing social distancing and people are not really in the office. So, I mean, we already have about a 52% solve rate for homicides. So I'd really like to see how if this is impacting our solve rate as it is and the investigators. But things are changing, you know, things aren't really shut down per se, but when you provide a service just in person all the time, there's going to be a change in how that service is provided, unfortunately.
It's disrupted, no doubt. And
yeah,
time will tell what the ultimate impact is for
right.
that population. You work with staff and clinicians who are already dealing with a highly charged social problem, and that's child sexual assault. How can leaders in public health and social work prioritize self-care with pressure from COVID-19, increasing so much, and so much about the broader effects of this crisis are unknown? You talked about your team group, and they're not coming together anymore, but How are they dealing individually with this this break in the service model and the concern that they have for children whose needs are not being met?
It's a good question, Barbara. And it's a really difficult issue. I think because over and above my actual team members, the people who work for the Philadelphia Children's Alliance, we also have Department of Human Services social workers and Philadelphia Police Department folks who are being told they should limit their contact as much as possible with the public, right? And yet they have this public mandate and responsibility. So there's this really challenging time for all of them. I think as somebody who has the responsibility of managing the day-to-day work, I think about a few things. One is, trying to be, this sounds kind of basic, but trying to be as empathetic and understanding as I can about the scope of what they're trying to manage, not having overly high expectations of what we're going to accomplish during this period, but also not letting up on the accelerator too much, right? Because we still do have this public responsibility. People expect that when children are sexually abused in the city of Philadelphia, that they're going to get the best response possible, that we're going to prevent any kind of recurrence if at all possible. And in addition to all of that, I think making sure that we address some of the challenges that their families are having. I try to have regular contact with my team members. We stay in touch on a regular basis. I write to them regularly, probably every day. We do staff meetings once a week, even if they're only for a short while. I try to remain transparent about what's possible and what isn't. I don't fool them. I don't try in any way to let them think that there are easy answers to any of this. And nor do I, in any way mislead them about our purpose, our mission, right? We're the people who are entrusted with this responsibility. And though we want to protect ourselves and make sure that people are safe, our first and primary responsibility is to these kids and families. I do a lot of encouraging of feedback. I ask people what they're thinking, what are their best ideas, how can we approach a problem in the best way possible, balancing all of those priorities that we have. And I take their ideas seriously and we incorporate them into the work that we do. We try to create a culture of teamwork not only in decision making, but also in the planning of work. I try to call out people for their work. We have team members who are really going above and beyond the expectation, going in and regularly facing families, being in the same building with families. We don't always know who we're going to get. We do some screening, but still, it's a risky situation for some people. So I like to call them out for that work. And even for the smallest things, like, if someone goes out and is able to find us masks, or someone's able to, do something that helps our technology, in some ways, all of that is worth recognizing. And then I think we also spend a lot of time sharing the load on things like difficult tasks and scheduling, so that no one person has the full responsibility, or that we're not using the same people over and over. I do think that during this time, there have been a couple of things that have, been noticeable for me. One is that we are getting really creative about the use of technology. And I think that it's not perfect by any means, and it's not what we'd like to do over the long haul, but there are some really good lessons learned from the use of the technology. And I guess secondly, kind of trying to figure out which of these cases, what is it that makes some of these cases more high risk and more dangerous than others in terms of the recurrence piece, and whether or not kids are still in imminent risk of danger. And I think all of those are conversations we'll continue to have long after this is passed.
Is it possible to use something like Zoom meeting for your forensic interview, to have everybody on their own camera as we are here, and the child maybe at the center with the main camera on the child? Does that work?
That's a great question. We have spent a lot of time trying to figure out what's the best technology that balances the issues around privacy, making sure things are HIPAA compliant, and then also attending to the needs of the families who might have some pretty urgent and imminent priorities that we have to address. So I think all of my team has learned more about technology than they ever thought they would or ever wanted to know. But we're getting smarter about it, and I think each week we find it's a little different, a little better. And it's not cost us a lot. It's certainly costs that we had factored into our budget, but we think in the long run it's going to be well worth it. And we've had some really generous funders step up and help us with some of that, those technology costs.
Yeah. I mean, there are some people who feel that one of the impacts of this virus will be that we find new models for serving people, that we do use technology more appropriately in the future. And
Yeah.
Kendra, you kind of mentioned that a little bit too in your talking about how you're working with teens, connecting them through technology. What resources are you using to meet the rising challenges and needs of the communities you serve? Are you developing new resources or new ways to address your teen groups or your adult victims?
Yeah, so I know the therapists at Anti-Violence Partnership, they are doing sessions through Zoom. And they said that they've been working out just fine. I know for teens, we've been using Google Hangouts or going live on Instagram. And so, it's hard because, Paul mentioned a lot of great things, and we do need new models of engaging just going forward, but it's also, we have to think through it. It's still complex because there's a lot of people in Philadelphia who just don't have access. And, it's easy for us to say, hey, let's get on Zoom really quick. But even when we look at the school district, they said that only about 50% of students had just access to the internet in general. So we have to find different ways. And while video and all of this is an amazing option in technology, I think that even so, we have to think about some alternatives. Even doing things like last resort over the phone may not be the best, but I know for our survivor of homicide interviews, the ones we're outreaching and who would like to do an interview over Zoom, we are using Zoom. And it's hard, right? It's hard. The interviews are super long. They're about 2 to 3 hours. And so if people are not willing, then we're just going to have to go back later on and find another way, or if they don't have the capability. And sometimes that's possible. So we still have to think through, other options for people. But now we've been using Google Hangouts, and we've been using social media, because a lot of the teens we work with, they don't have their phones are cut off, but if they're connected to some type of Wi-Fi, they're able to still video call and text and do all of that. So we've been lucky with that, and the engagement has been really great. So we're just trying to think about some other ways outside of video for the people who we know benefit around just in-person contact. I know we still give out food, and we have a couple teens who are struggling with some severe depression. So we take the precautions, and we have the masks and the gloves and 6 feet social distancing, but we bring those few teenagers with us to give out food because it gets them out of the house and it has them doing some other things. So even in the midst of, we shouldn't be doing things outside of essential things, we've been trying to give out food more and deliver groceries to people and engage the teens and bring a couple of them with us who we know are really struggling with some mental health symptoms.
Might be an interesting foundation grant to write, to ask a foundation to provide the funding for cell phones or iPhones and internet connection for
Definitely.
Victims of violence.
Definitely.
I mean, maybe we can't give them to the whole city of Philadelphia, but maybe we can get them for some of the vulnerable people who really need them.
Right. It's a barrier. It's a huge barrier.
Yeah. Good luck. Just a point of understanding here. Are neither of your programs considered essential services in Philadelphia at this point? You have to be shut down?
Well, it's interesting that came up, and it's come up in a number of child advocacy centers across the country, not just here in Philadelphia. When we spoke to the Department of Human Services, they were pretty clear that as it relates to forensic interviewing, they considered us an essential service. But we also realized that some of the forensic interviews we do during the day are not considered to be urgent, right? Some of them could be a case reported from, maybe somebody who wants to report or talk about a case that happened several months ago, and they're currently safe, but they want to be able to disclose their story and then get the help they need, as opposed to a situation that's happening, in real time over the last 24 hours. So I think other agencies around the country are dealing with a similar question. Are we an essential service? I mean, it seems to me that that the people who ask the questions of children who have been sexually abused, and there's an arrest going on, and there's kind of all that crisis happening around the child, you want somebody to be able to ask the questions in the right way that will not re-traumatize kids, and also to be able to provide the families the services in real time as well.
Right.
I want to come back to something that Kendra mentioned just a moment ago, and it relates to this issue around the technology. This point about, that there's a lot of families who don't have access to internet. I think that's true. One of the things that we did, because of this concern we have around social isolation, is last week we started going through cell phone numbers that we had of families to see maybe we use those as a way to text families a list of resources. So we put within the text a link that can be clicked on just about anywhere, and that link will bring up for the family and for professionals a wealth of resources, where to turn for this or that, phone numbers, everything they need in that link. And so we wanted to do just a pilot of this to see how it would work. We sent out about 60 of those texts, and I'm really happy to say that all 60 of them reached the families that we were trying to connect with.
Wonderful.
Yeah, so no kickbacks. And also in the text was a phone number that they could call at PCA. And if they had questions of us or a concern, something was happening that they needed an immediate answer, we could be able to respond to that. So again, to this point about using technology, it was something, probably 10, 15 years ago we wouldn't have thought about.
No. Kendra, you could probably talk on this forever, but I want to just ask you to just give us a couple of thoughts about how a recent Temple grad from the College of Public Health, how your education has prepared you to fulfill your current role.
Definitely. So I am a firm believer that people who come from Temple do things that other people are just not doing. Like Temple has given us the confidence, and in my experience, they teach us how to be great. And just from, our internship, other colleges don't have or didn't when I went, a year of internships and experience. And just the knowledge that we received, but also the building of go out there and be great, go out there and be different and be originators. So I'm really grateful for the things that I learned at Temple. I can't speak enough on how many people and alumni I see every single day, just literally across the country and throughout the world doing things that other people aren't doing. So I'm grateful for that, and just teachers pushing us to be different and think critically about things and to be leaders and, be innovators. So I think that's my main thing about what I was taught when I was at Temple, and I'm very thankful for that. And it's prepared me to do anything. I'm definitely a trailblazer, and I'm very outspoken, and I'm very, just about creating my own lane. So I definitely credit a lot of that to Temple.
That's a great point. I wanted to comment on that too, if I could. You know, I was just thinking about this the other day. The very first day in my very first class at grad school at Temple, the professor was the late Jeff Galper, and he asked us, you know, all about what we were doing, why we were there, et cetera, what was motivating us, and we all had these great answers about, you know, how we were going to change the world and save the world and all those kinds of things. And you know, he looked at us and said, you know, I don't want you to make have any illusions about what you're doing. So the role of social workers is essentially to clean up the accident victims of this society. And it was such a profound statement. And I remember at first thinking, gosh, what a cynical thing to say. But, you know, as time has gone on, and I'm not sure if that's because I'm older and more cynical, but it just seems like, you know, we are in many ways in a position of having to attend to and to be there for support, to do whatever we can to address the challenges and the opportunities for families who are on the margin, for individuals who are on the margin, whether they're teens, whether they're little kids, whether they're senior citizens. But, you know, the families, I can tell you the families who enter the system at the child welfare system, and I've been doing this for a long time, they're really the families who have this kind of long-term chronic issues that really exist in the context of poverty, of racism, of the lack of adequate resources, the lack of common sense, practical services. You know, and yes, families and individuals bear responsibility for themselves. I have no question about that. We all have responsibility to attend to our own challenges and take advantage of our own opportunities. But there has to be, you know, a level playing field. And since there isn't, I think that's why social work exists, right? We're there to help those people who don't always have access to the level playing field.
Yeah. Well, I want to ask one final question. Paul, when you and I talked earlier, you said something that I thought was so profound. And I was hoping that you might share that with us again on the impact of COVID-19 on social services and what your vision is and hope is for the future.
Well, you know, I think the analogy that I probably share with you is I think that the families that we see, and I'm sure this is similar to the kids that Kendra sees in her work, you know, like this pandemic, we've waited too long to do anything, right? We don't look at the warning signs. We do more social watching than social working. And we wait until things are too long past for us to seize the moments, to seize the opportunity to do something. And so I think, you know, there's a lesson to be learned from that. Families, individuals, senior citizens, it doesn't matter who we serve as social workers. The issue really is the longer we wait, the worse things get. And so we have a responsibility to respond to families who, given the right resources, will succeed, right? Families, we describe them as fragile, and yes, they are in some ways, but on the other hand, they're tremendously resilient. They bounce back, they continue to do things on a regular basis. I don't know how I would manage 3 and 4 and 5 kids, some of whom have special needs, and then being stuck in the house every day because of this virus and not knowing that I'm going to have a job at the end of all of this. I mean, all of these things are quite stressful, but families manage somehow to survive. And I do think our primary responsibility right now is not only attending to what we think of as the emergencies, but also be thinking long-term about how we prevent and support families, how we prevent challenges and really support families with the right opportunities.
Future. Well, thank you so much, both of you, Paul and Kendra. Paul is from the Philadelphia Children's Alliance, and Kendra Van de Water is from the Anti-Violence Partnership, and both in Philadelphia. Thank you for joining us today. on our Alumni Insight program discussing COVID-19 beyond the biology. I want to just say a point to our listeners, people who might be tuning into this, because if you would like to share your stories about how COVID-19 has impacted your service delivery, or if you have any questions that have arisen from our discussion in the last 30 minutes, we want to invite you to put your comments and send your thoughts and questions at the Temple site. It's the CPH, College of Public Health, cph.temple.edu/COVID-beyond. There'll be a slide that comes up for you on this website, so you can jot it down, and hopefully we'll hear from you as well. Thank you again, and really appreciate your being with us today, Paul DiLorenzo and Kendra Van de Water.